Well, good morning, Grace Church. As we said, for the next few weeks, we will be talking about mental health. Now, mental health, obviously, it's a very comprehensive topic because mental health really affects, a lot of areas in our lives, whether it's even physical, affects our social well-being, and even our spiritual well-being. So really, there's no way that we can address every elements of mental health. But that is not the point of our sermon series, because our aim is to merely open the door and just to have the chance to candidly discuss this in our church. And so for the next 3 weeks, we are looking at three major and common health problems that people often face, especially at this time. And that is anxiety, depression, and also addiction. And today and next week, I will be joined by Dr. Kuruvilla George, who is currently, if I get this right, the Deputy Director for the Center of Theology and Psychology at MST. And he will just be giving us a short input as a professional on these issues. Now, welcome, Dr. Kuruvilla.
Oh, thank you very much, Pastor George Johnson, for the invitation.
Yeah. Now, before we get started, aside from lecturing at MST or Eastern College, I know you've had more title and experience in that. Can you tell us some of your professional background and experience in this field?
Sure, yeah, certainly will. I mean, like I gather many of your church members are from Singapore. I was born and brought up in Singapore, did all my schooling there. And then because my father from India wanted to always go back to India, I went back to India, did my medical education in India, and then went to UK. When I was doing my internship, I changed my whole medical career around. I was going to be an obstetrician, but certain things that happened in my life, God led me to psychiatry. So I went to UK to do my psychiatry. But in between going from India to UK, I did some time on the organization called Operation Mobilization on their first ship, the Logos, as a ship's doctor. Went to UK, I did my psychiatry. My wife that I first got to know on the ship, she was a ship's nurse, but then she went to India, came back from India, and we were married, and we had 4 children in UK, one after another. At one time, 4 under the age of 4. Then we felt led to come to India to do some mission work. Left UK, came to India, where I was the General Secretary of what's called the Evangelical Medical Fellowship of India, and travel all over India, mission hospitals, medical colleges, doing Christian ministry among medical and dental students and graduates. Because of our children's educational needs, we finally felt we had to leave India and go back to UK, but were led, again, we never even considered Australia. Came to Australia in 1995. I'm a geriatric psychiatrist. I've been working in that space, but also did some time for about 10 years as the Deputy Chief Psychiatrist for the state of Victoria. And have recently retired last year. I was the clinical director of the Aged Persons Mental Health Service for Eastern Health, and also the director of medical services for Peter James Center, and also the center near you called Wanturna Health. So I was the, Yep. So I'm getting a bit more involved in a number of Christian ministries, and the Center for Theology and Psychology being one of them, and other ministries on a voluntary basis. So that's my life in short.
Any grandchildren?
Yes, we have got 4 grandchildren. My wife is from the UK, and all the children are here, fortunately, in Melbourne, nearby, and we've got 4 grandchildren, and I'm enjoying that.
Is the lockdown restricting you at the moment in seeing them, or?
Yes, certainly. It's been restricting seeing them as freely as we would like to. But now that we are opening up, we are thinking about having a picnic this Sunday.
Yeah, that's right.
Monday, somewhere. Yeah.
Now, you mentioned to me before in our previous chat that one of your passions now is really educating churches about mental health. Just a quick mention, and forgive me if you're going to address this later on, but awareness on mental health has been growing for the last few decades, but But it seems like churches are quite behind on jumping on the bandwagon. What do you think that is?
Well, yes, I would love to speak about that. As you said, that is my passion, and I do quite a bit of teaching in that area. But the interesting thing, Raphael, is that with this past 2 years and the COVID crisis, many Christians have become a bit more open to talk about this topic, and that's probably interesting and a good thing, I think. There's been lots more anxiety and depression, and so people are beginning to be open to consider that. I mean, unfortunately, I will probably try and but we won't have time to do that today. But if there was an opportunity, I would like to look at why, as Christians, we have this stigma and prejudice about mental health and illness, which even when I was working as a psychiatrist in UK in the 1970s, when I started training, even in a country like UK, there were very few Christian psychiatrists because the view was that it is a non-Christian specialty. And I used to have to tell people, hey, look, psychiatry is no less or more Christian than any other field of psychiatry. And for example, if I had gone to my initial interest of obstetrics, in this day and age, I would probably have more conflicts as a Christian obstetrician about many issues than I would have in psychiatry. Really. So, unfortunately, there's always been this sort of stigma that has been there.
Yeah. Well, without further ado, please take it away and present to us what you have ready to go on.
Thank you very much. I'll share my screen if I may. Greetings to the church. As we just talked, this is a passionate area of mine. Now, I've been invited to speak about anxiety and depression. Some of that can't be split. So what I'm going to do is talk about some things in general today, and then next week, some other things, which I will talk something specifically about anxiety and depression, but some of the things will be general. So what I'm saying is I'm encouraging you not just to listen to this week, but to next week as well, and possibly the third week if you can as well, definitely, to get a more wholesome picture of what I'm trying to say. So as an introduction, Christians have traditionally viewed psychiatry and psychiatrists and mental health, I would say, with suspicion. And this stigma, unfortunately, is still present even in the 21st century among Christians, even among pastors that I've found, and some Christian leaders. There is no difficulty that we find when for Christians and in Christendom to accepting physical illness among Christians. But when it comes to mental illness, what I have found over the years is there are sort of three specific problems that we find. There'll be one group of people who will say that this is all, there's no such thing as mental illness, it's all due to sin or due to the sins of parents. Another group will say, probably I would say the middle group will say, this is all spiritual weakness or lack of faith. And the third group, another end, very often more of the Pentecostal charismatics who will say, there's no such thing as demon possession. Sorry, there's no such thing as mental illness, all demon possession or a demon oppression or due to curses. First of all, before we think about either anxiety or depression, there's a few things that we need to look at it generally. There is what definitions about mental health. There is more to good health than just a physically healthy body. A healthy person should also have a healthy mind and spirit. And I'm sure you'll all agree with me about this. A person with a healthy mind should be able to think clearly, should be able to solve the various problems faced in life, should enjoy good relations with family, friends, and colleagues at work, and should feel spiritually at peace and bring happiness to others in the community. Just reflect about that, and I'm sure you won't have any problems with that definition. Now, so when it comes to mental illness is any illness experienced by a person which affects their emotions, their thoughts, or their behavior, which is out of keeping with their cultural beliefs. And unfortunately, that's an interesting aspect, but we don't have time today to cover that. Why do I mean out of keeping with the cultural beliefs? And also personality. And is producing a negative effect on their lives or the lives of their families. And that's what we call as mental illness. So why should we be, as Christians, be concerned about mental illness? There are various reasons. First of all, because it is a major public health burden. And it is estimated that around 300 million persons in the world are affected by depression. We'll be talking about depression next week. And about 3 million of them in Australia. 3 million who suffer from anxiety disorders. 3 million in Australia again. And 200 million from alcohol and drug use disorders that you'll be looking at as well. And 50 million from dementia, which is growing as people getting older. Now, this burden is not only in terms of health, but also affects human rights and economy worldwide. Loss of productivity, sickness, absence, unemployment, physical comorbidities, increased hospitalizations, premature deaths of persons affected, and carers. Thirdly, because mental illness is very disabling. Mental disorders are among the 10 leading causes of disability in the world. Fourthly, because mental illness services are inadequate. And the treatment gap is 50% globally and 85% in low and middle income countries. Even in a place like Australia, you would have probably heard recently, even with the pandemic, people are saying there is a hidden pandemic, not just the COVID, but the pandemic of mental illness. But even in a country like Australia, when you look at the amount of money that is spent in mental health compared to what's spent in other areas of health, it's very low. People are pouring much more money here in Australia, but when you compare in lower and middle income countries, it's terrible. It's lowest in the area of priority when it comes to funding. Because mental illness leads to stigma, because mental illness affects us all, everyone, whether we are yellow, brown, black, white, whether we are Christians or non-Christians, believers or non-believers, we are not immune to mental illness. Let us get this out of our mind. Just because we are Christians or believers, that we will not suffer from mental illness. That is wrong teaching. And I wish I had time to look at some of the reasons why we have come to that false teaching. And because God loves the mentally ill. Now, what are some of the characteristics of mental illness? Abnormal changes in a person's thinking, feeling, memory, perceptions, and judgments, which are longer lasting, resulting in changes to the person's behavior. These changes cause distress and suffering to the individual and or others. And the abnormal changes and distress affect the person's daily life, activities, work, and relationships. Now, when we talk about mental illness, some people think, mental illness is only one kind of mental illness. I'm not going to go through all this, but it's just to give you an idea that there are 101 different kinds of mental illness. We're not just talking about one mental illness. Here are a group of what we call psychosis, or the severe end of mental illness. And many of you would have heard of schizophrenia, bipolar affective disorders. They all come under psychosis, along with delirium, dementia, and so on. And also a kind of depression we'll be looking at next week called psychotic depression. Then we come to what's called a group of what we call neurosis. In the past, we used to call it neurosis. Now we call it stress-induced disorders. And in that come things like anxiety disorder that we were wanting to talk about a bit more today. And generalized anxiety disorder is one of the stress-induced disorder. There are what's called phobic anxiety disorders. I'm sure you've heard of people having phobias, of closed spaces, open spaces, spiders, snakes, whatever, water, heights, panic disorders. People get into panic situation, acute episode of anxiety, which sort of completely paralyzes people, obsessive compulsive disorders. And then there's a kind of depression which is called neurotic depression, more stress-induced depression, and so on and so on. So these are all what we call neurosis or stress-induced disorders. Then we have what's called personality disorders. There are multiple different types of personality disorders. You might have heard of narcissistic personality disorders, sociopathic personality disorders, schizoid personality disorders, borderline. People are talking lots about that, borderline personality disorders. Then we have alcohol and drug dependence disorders, many different types, eating disorders, anorexia nervosa, bulimia nervosa, sexual deviations and disorders. This is an area we have to be more careful these days, because universally it is not accepted that some of the disorders we used to think were disorders are now been normalized. Intellectual disability with or without coexisting psychiatric disorders. Mental disorders of children, a huge area. So that's why I'm saying there are 101 different types of disorders. So when we look at that, and this is where we look a bit more into, when I say etiology, what I mean is, what is the reason? What are the causes of mental illness? Why do people suffer from mental illness? Let's look at, for example, anxiety, because we are going to spend some time on anxiety. There are a few minutes on anxiety. And we can look at any disorder in all these areas. When we talk about, for example, the COVID-19 pandemic that we are suffering from, it is easy. When it comes to many physical disorders, you'll say, the reason for it is there is a virus that we are dealing with, a small little virus that's causing this havoc in the world at present. Or we talk about, heart disease or whatever. We see the cause much more clearly. But when we talk about mental illness, we have a term that's often used, and that is called multifactorial. What do we mean by that? That we're not dealing here with a single factor that has caused the illness. There are multiple factors that have contributed to the mental disorder or imbalance or illness or whatever you want to call it. So what are some of these? First of all, genetic or hereditary factors. So when we talk about, for example, anxiety, it is known, that some people are much more vulnerable to anxiety than others are. We all know it's same with pain, for example, physical pain. Some much more, we all suffer pain. It is not that we don't suffer pain. Pain is a real thing, but some people are able to tolerate pain better than other people. I've got a high tolerance for pain, but and I don't even usually complain when I have pain. But of people who just at a small injection and immediately they'll be reacting. Now, are they weaker? No, I wouldn't say they are weaker, but that's the way they are. Okay, so genetic or hereditary factors. It is well known, that genes or hereditary do contribute to some people being much more anxiety prone than other people are. That doesn't mean they are weaker in their faith, doesn't mean that they are weaker mentally, it doesn't mean that they are weaker emotionally, but that's the way they are. Secondly, psychological factors. Yeah, this is very important when it comes to anxiety. For example, the person's upbringing, the developmental years are very, very important when it comes to a person's, many of these mental illnesses that we are talking about. What has happened during the developmental years which could have contributed? Maybe it has been the fact that they have been brought up in an environment like many of us Asians have been, where we don't often praise our children very much. We feel, I was brought up in a culture where it was felt that if you praise your children too much, you're going to spoil them. But psychologists tell us these days, no, praising children do not spoil, you don't spoil the child. If you do not spoil children, if you don't discipline them, you can spoil them. But praise is absolutely necessary. So maybe because we have been brought up with parents who have always been expecting more from us. If you go to school and then at the examination you get 80% and you come home and say, oh, I got 80 marks. And then the usual response is 80? What happened to the remaining 20? You know, the expectations, which make us then feel, you know, we have not raised to the expectations of our parents, and you are constantly anxious about that. You know, that could have contributed during our childhood days to make us much more anxiety prone as we get older, to psychological factors like that. As I said, I don't have time to look at so many. There are so many factors like that. Social factors, maybe, again, things that have happened in our life, you know, children's, in our time as our growing up, or other times where our relationship with friends, relationship with others have made us much more vulnerable to be anxiety prone because of things that have happened in our life, which have resulted in long-standing impact that has happened as a result of that. Again, that does not mean that they are weaker spiritually, does not mean that they are weaker psychologically or emotionally. It's because these things have happened to them, which fortunately might not have happened to us, which have left a scar on them, a trauma on them. We're talking more about trauma these days. Biological factors, very important. You see, many anxiety disorders could be due to things that are happening in our body, which make us much more anxious. For example, it is well known that people who suffer from, I'm just giving you an example here, some endocrine problems like thyroid. If you have a hyperfunctioning or high functioning thyroid, what we call hypothyroidism or thyroidism, then they can have anxiety symptoms. They're always showing symptoms of anxiety because there is much more thyroid in their system, which make them that prone. So it could be things that are happening in the body which could contribute to the symptoms that they're exhibiting. So we often talk, when we talk about psychiatric disorders or mental health issues, these are the terms that we use, which are called biopsychosocial. So there is a biological factors, psychological factors, and social factors which contribute to the illness. And about 10 years ago, a new word was introduced, and that was lifestyle factors. So we talk about BPSL. So maybe your diet, your exercise, all these also can contribute to the illnesses or upsets that are happening mentally. So we call biopsychosocial lifestyle factors. And I have introduced this as a Christian. We can talk about, yes, there are spiritual factors that are also important. We know that as Christians. So we can use the term BPSLS, biological, psychological, social, lifestyle, and spiritual factors which might have contributed. So it's multifactorial role when we talk about etiology of anxiety, or now we are talking about anxiety or any other mental illness. And the role of stress is very important in mental disorders. So let me end here. There are many things. So when we come to the treatment of, let's say, any mental illness, including when we talk about anxiety, especially we're talking about this week, we also use the same terms. When we talk about management or treatment of anxiety or any mental illness, we talk in terms of biological treatments, psychological treatments, social treatments, and lifestyle treatments. So biological will be things like, if anxiety goes to the point, we often say if it is anxiety, we don't have to use medications. It's better not to. But if it has come to the point where the anxiety is so handicapping the person then we might have to, in the short term, use medications, and that's biological treatments. Or because they are suffering from physical illnesses which are causing the anxiety, then certainly they will need to have medication to help them, for example, with this thyroid. Psychological treatments, yes, things like what psychologists often give treatments, psychotherapy. There are many, many, many different types of psychological therapies that are available. Social therapies that are involved, whether it could be things like occupational therapies, other areas of social therapies. There are again multiple that are involved in treating a person, and lifestyle therapies, whether it been diet has been contributing, exercise, more and more. In every illness, we are talking about diet and exercise. Even when we talk about dementia, increasingly people are talking about these are the important factors that we need to consider. And as Christians, obviously, we also can include spiritual factors or therapies or treatments or whatever, that we can help with a person who is suffering from, let's say, as an example today, anxiety. So when it comes to the cause, we talk about biopsychosocial, lifestyle, and spiritual. When it comes to managing a person, helping a person, we talk about biological treatments, psychological treatments, social treatments, lifestyle treatments, and spiritual treatments, depending on the degree of anxiety, what has caused the anxiety, then the treatments will also depend very much on that. So we'll stop that for today. We'll continue next week, and I'll consider some other areas when we talk about depression next week. So I hope this has been helpful. And as Pastor Johnson said, I'm happy to come anytime to talk further about many of these areas, a Christian perspective on mental illness, a Christian response, and even about the pandemic, the crisis situation, looking at some psychological and theological inputs into how we can deal with that. Thank you very much.
No, that was absolutely helpful. And yet, as you mentioned, that there is just so much to learn and to talk about. It's really, like, for me, it's creating a lot of questions as well. And again, as Dr. Kuruvilla said, that he is offering a lot more information. Maybe we can do a seminar. Maybe we can do some sort of Q&A with him. If you are interested, please let me know. My email or message me. And if I gather enough interest, I will definitely plan to something so that we can absolutely learn more. But just a quick question, Dr. Kuruvilla, that you mentioned that when someone's anxiety is starting to handicap them, when is it handicapping? I mean, like, for example, like if you are in year 12 and you're stressing about your exams, that it's just normal anxiety, or is it really kind of affecting you personally? When should you jump and get a professional help?
Right. So if, as I think mentioned in the characteristics of mental illness, or probably even the definition, we'll go to the definition. Anxiety is something that we all experience. Every human being does. If anybody says, I don't feel anxious, then they are not being truthful. Every one of us has periods of anxiety. It is normal. God has given it to us. And again, we don't have the time. We have all heard of probably the fight and flight reaction or response. That is God-given. Animals have it, human beings have it. So where, we throw a lot of chemicals into our body to when there is a crisis situation that happens, or stress, for us to deal with it. Now, so it happens to us. But it is when this emotion, it's an emotion, comes to a point which where it affects our emotions, thoughts, or behavior, comes to the point it's out of, it begins to impact our normal life. So as a student, if it's beginning to impact so severely our concentration, ability to study, our sleep is being impacted, our appetite is being impacted, our relationship with our family, our friends is being impacted to that point because of our anxiety, it is constraining us to that degree, then that's a point that we need to have seek help.
Yeah. And just a quick one, how can they easily access help? Like, what's the best kind of procedure for them? I know we know that there's things like Beyond Blue, Lifeline, and all that. But what are some kind of steps that they can go? Like, look, I do need some help. Who should they approach?
Yeah, so we'll look at that probably again a bit more next week. I was thinking more to deal with looking for help and how to do that when we look at depression. But very quickly to answer, I would say certainly first thing is if you're a young person, then talk to your parents first. Be open. You know, the first thing that which I talk about when we are in a crisis situation is to acknowledge what we are feeling. If you don't acknowledge what is going through, I can't seek help. I can't, even begin to recognize what it is. If we try to suppress it and say, I'm a Christian, I shouldn't be feeling it, we won't be able to then go the next step to seek help. So first thing is to talk to people that are close to you. And it is something that you find that they are unable to probably help you with support, is to go then to somebody who is, if it's a pastor in the church who might be able to direct you, or go to the GP. The GP is a central person to go to then be able to seek further professional help, whether it be a psychologist, because these days there are psychological help that can be, even through Medicare, about 8-10 sessions that you can have free, on Medicare. So if it needs a psychological help, or the GP feels, look, this is so severe, they need some medication or whatever, they can do it in the first instance before referring it to a psychiatrist or someone else that needs to assess them and do more professional treatment.
Well, we can probably keep going for hours here, but we do have to cut it short. But that was absolutely helpful, and we do look forward for more information next week when you join us. But for now, thank you again, Dr. Kuruvilla, and God bless you.
Welcome. Welcome.